Hi, I'm Cassie Nusper, the curator of the Melnick Medical Museum at Youngstown State University. Today we're going to talk about what it was like to be a doctor in the early 1800s in northeastern Ohio. First of all, there were no hospitals and very few doctors' offices in this area. Most people lived in small villages or rural farms. This is a picture of what Youngstown looked like in the early 1800s. So the doctor would come to your house if you were very sick or had a medical emergency. And he would have to carry all the tools he needed in a bag like this one. As you can see, there's not much room, so the doctor would only bring the most common tools and medicines. To examine you, he'd use a tool like this one. Do you know what this is? This is a wooden stethoscope from the early 1800s. As you can see, it only uses one ear. The rubber tubing used to make two-eared stethoscopes wasn't common until the late 1800s. In this time before tests to see inside your body, doctors were trained to listen to the sounds of your body to diagnose problems. They would use a percussion hammer to tap on the outside of your body and listen to the sounds it made, either using the stethoscope or their ear directly. In this way, they could hear things like fluid in your lungs or an obstruction in your intestines. After diagnosing you, the doctor might use the medicines in his bag to treat you. Most of these medicines made you throw up or go to the bathroom a lot. We'll talk more about 18th century medicine in another video. Another common treatment was bleeding, using lancets like these ones. Bleeding got rid of excess heat in your body and helped balance the humors as well. If you want to know more about bleeding, you can see our video on that. Some doctors used leeches to bleed their patients and may have carried a small box like this one to store their leeches in their bag. Other patients may have needed simple surgical procedures from their country doctor. Usually, more complicated surgery was referred to the city doctors in the hospitals. Common country doctor surgeries would have included amputations of fingers and toes, lancing boils, or removing abscesses. In some cases, the doctor may have used anesthesia with tools such as these. This is a mask that would go over your mouth and nose, and over it, the mesh was placed a cotton rag, and then liquid ether from this canister would be slowly dripped onto the cotton. Surgery only lasted a few minutes, so anesthesia time was very short. Doctors were also called when patients had accidents on the farm or from machinery. They would stitch deep wounds and set broken bones. They would have carried silk thread, like this, in their bag, and they would have used wooden splints, like this, for broken bones. After the bones were set, the splint would have been attached to the limb with strips of cloth or a bandage. So there you have it, the country doctor. Be sure to check out our other videos on the Melnick Medical Museum YouTube channel. And join us next month for a video on common 18th century medicines.